But really what I wanted to do is basically go over some insights into what we call the patient's decision-making process when it comes about their hearing healthcare, and some of the decisions that they make and some of the things that they're looking at and looking for in order to drive that decision. The path to purchase analysis that we've done was fantastic. It was really interesting. So another disclaimer, sometimes when I get onto a subject that I love, I can talk too much. So we have some timekeepers in the back that's going to keep me on track. And one other thing, I have a couple of slides here where I really want to get your audience participation. Won't be a whole lot, but I would love to ask you a couple questions to see what you respond to. So let's go ahead and get started on this. There's a couple of things I want to show you. You know, we all make choices or decisions in every day, whether we have plain M&Ms or peanut M&Ms, whether we decide to go skiing or if we're going to go spend the time at the beach, whether we're going to have a little cute puppy or we're going to have a pet, a cat, for example, or whether we're going to buy that sports car or whether we're going to get that van. All of these things are about decisions. And reality is, I show you that because you and I, all of us, make thousands of decisions every day. It's something around about 35,000 decisions are made on any given day. Some are very small and trivial, like plain or peanut M&Ms, but some of them are very, very important decisions that we must make. And so is the path to purchase for our patients and consumers when it comes to their health care for their hearing. There are some decisions that they must make, and what it is that they are planning to do that. This study, and by the way, all of you have a copy of the Path to Purchase study that was done. CareCredit was not the one that actually, we did not conduct it, but we commissioned another group to do the study for us so that there wouldn't be any biases whatsoever. And so what it is really was, we sought to understand what the patient's decision-making or the consumer's decision-making process was when they're trying to decide on health care for their hearing. We surveyed patients who had made or were about to go and make a decision and purchase requirement for their hearing aid and for their hearing health. So that's what it was. In that report that you have at your desk, you'll find very good information and a lot of great statistics and a lot of great findings from the path to purchase. But really, we boiled it down to a couple of key findings that I thought you would be interested in today. And so really, I'm going to talk about from a patient's perspective. Patients really sought to really boil it down to two different types of questions. And that is, should I get the health care for my hearing? And then, can I really get the health care for my hearing? Those are really the two findings. So we're going to look at those two aspects that was brought out in the path to purchase. First, let's look at the should I. And you all know this is probably better than I do. When a patient is contemplating or a consumer is contemplating whether they want to get their hearing fixed, they really have to own it, right? They have to own the fact that they really believe that they have a hearing loss. Perhaps their significant others or others are saying to them, you know what, you really can't hear, right? You need to get your hearing done. Or they may have to get over the fact that, if I do get a hearing aid, I may look too old. I'm not that old. I don't want to look that old. Or because it's called a hearing aid, it sounds like I have a defect and I must adhere to that aid thing. So with that, once they understand that process, then are they willing to also understand, with the help that is given to me, will it really truly benefit me? Will I really be able to hear better? And that's where you guys come in, obviously. But with that, though, what's interesting is, in this survey, it brought out that hearing health, to all those that actually answered it, the majority of them said it was really considered a quality of life issue. After they got past the idea that they may have to have hearing corrections, it's about the quality of life. However, patients took their time. This is from the time when they really believe they have a hearing issue to the time that they go out to get it taken care of. 97.7 days is in the research and decision to purchase. So what are they doing in that 97.7 days? Well, the vast majority of patients, actually 88%, are proactively seeking information about the treatment and the products that will help them with their issues and how to solve for them. That's probably not anything new. It's probably not anything revolutionary, but the fact is, it's bringing out that people are searching for information. We're going to find out where are they searching for this information and what type of information are they searching. And so that's my first question to you guys. What source do you think most patients look for information? There's three choices here, and it may be a combination of those. How many people really believe that they first and foremost look to their friends and family for information about hearing? Just show of hands. Good, we got about 6 or 7. How about providers? They actually go to you as a health professional and, okay, 2 or 3. How about the internet? Ah, interesting. You're right. So let's see what it is. Where did they do their research? 82% actually sought information from providers' offices. You're the healthcare professionals, right? You're the one that really knows how to take care of them from a healthcare perspective and what they truly need to fit or correct their deficit, if you will. 67% talked to friends and family. 50% of those went online. And that's not to say these are exclusive columns, right? Not 80 to 82% only did provider. It's really a combination of all of that. But what's really interesting is a lot of people think that because of the age demographics or so, that many are not searching online for information. The path to purchase actually brings out that they may be searching online before they even come to you. They certainly need you to fulfill the information from a scientific and practicality for them, but they are searching information. And that's what we're going to talk about a little bit more here. Where and what do they research online? What percentage of patients do you think went online to websites that provide reviews of providers? Anybody? What percent? 5, 10? 30? 80? Great. So we have 30 and 80, and somewhere in between. So what the research brought out was that 55% of consumers that answered this and patients said they went to the provider review sites. Those are like WebMD and other ones that talk about hearing. Maybe at Google, and they went to those sites to get information. 59% actually went to medical advice websites. 58% went to providers' websites. That's almost the same as going to a medical advice website. And then 56 of them went through other provider options. That is, do I go to an ENT? Do I go to an audiologist? Or do I go to that other entity to get some hearing aids? So the information here is, what's interesting is 58% of all those, of the 50%, said they went to a provider website. Now, they may have gone to you because of the fact that they have friends and families or that have had experience with you, or they may have just Googled you, or they may have Googled something where you actually come up. So it's very important that your search, that you maximize your SEO in order for people to bring up. But the fact is, your websites are extremely important to get information. And one of the things you want to do is make sure when the patients come to you, you're alleviating at least 2 things. That is, they understand a little bit more about the science and what's happened for their hearing, that what you can offer to them. And then there's another thing, and that's called cost. So once a patient decides that they should get care, the focus comes from should I to can I? Can I get the care? How can I fit the hearing care into my life, into my budget, into my schedule? And we came up with that because if you were to read the verbatims from our research, these are what people said. Wow, you know what, I may have to sacrifice this in order to get hearing. Or, you know what, they had me coming back 2 or 3 times. I don't think I just had the time to come back. You know, maybe if I can be taken care of in 1 session or 2 at the most. Those are things and factors. How's it going to affect my life? How am I going to look? Again, these are things that you probably already know, but now we have some objective research that came back unprompted from people, and this is what they've said if you were to read all the verbatims. So to answer the questions, patients researched in 2 primary topics. That is, they research what the treatment and what products are there out there that can help me, so they think, to solve that problem. And interesting enough, they also research cost and subset to that financing. And that's where we and you alike have to make sure we can dispel or answer these questions so that the patients can move forward with the care in which you are actually recommending for them. So, do you think more patients research treatment in products or cost and finance? That's a question. Who wants to be brave enough to answer that? How many people say they probably research more about the treatment and the product? 2 people, 3 people, 4, 5, 6. Can I get a 7, 7, 7, 8, 8? There, great, thanks. Oh, how many people, so the rest of you say cost and finance? How many people believe that? You know what? Remarkably, it's a little bit more than those that said treatment and product. So what was the result? The results said that 84% of patients research cost and finance. It's a little bit less, though. 88% said they actually researched treatments and then products. But essentially, they're about the same. Yes?
The age factors that age rate?
No, we didn't do it by age perspective, per se, but it was from those people who were roughly, I think the average was like 35 and above. We did it for a lot of different markets as well. So some of the research, some of them were CareCredit cardholders already, and some of them were not. And the majority, our average age of a cardholder that opens up a CareCredit card for hearing is around about 50 years of age. What's interesting about this is it may not necessarily just be the patients that's doing the research. It could be their loved ones and other ones that are researching for the person who may have the hearing issue. Okay. So under the same category as can I, 32% visit the providers regarding cost. So of those that came to the providers, 27% of them also asked about financing at the provider site. And I'll come back to this in a minute here. At the bottom, of those who went online, 52% researched cost. What is it going to cost me to correct my hearing, right? Unless it's an emergency or unless it is really something other than a hearing aid or so on and so forth, they're more than likely saying, well, I can't hear because I need a hearing aid. And they actually want to say that, but only 9% actually were researching financing for those that went online. So you may think that maybe financing is not that big of a deal. However, what's interesting is that even though there was a significant concern, 74% of respondents were not even aware that financing is there to help with their hearing health needs, right? 74% wasn't even aware. So that does 2 things, and I'll get to as to how to apply to you. But for us as CareCredit, that gives us an opportunity to do more direct-to-consumer, perhaps on websites that actually where consumers are going to and letting them know that financing is available. And that's something that we're looking at. It's certainly going to help us, obviously, but it's certainly going to help the profession here because once they get their approval for financing, get that out the way, it makes it a little bit easier when they go to your practices to actually start to transact. So many respondents indicated that they had to delay their care because of cost. Some may have said that, and have actually said in the verbatims, that they had to sacrifice other purchases in order to afford hearing health, right? So is there room for financing? I think all of you would agree there is, but we'll go on and say how much really can be happened to really get that out into the mindset of the consumers and to the patients. Well, it was interesting when we asked another question of this same group. When they were made aware that financing was an option for them, 48% indicated that they would have considered CareCredit if it enabled them to get the care that they wanted immediately. You can use it as patient financing in general, but obviously I work for CareCredit, but CareCredit in particular, when we talked about and presented different ways financing company, they said if I'd known about CareCredit was available, 49% of them would have, or 48% of them would have went forward with the care that they wanted. So what does this all mean to you? Providers can help facilitate patients' decision-making process by providing the information and solutions that they're seeking. Again, not anything new, but it may be the way that you go about providing that information will give you some food for thought. For example, do you have a strong online presence? Because remember, 50% of those that were surveyed said they went online to seek information. That includes information about your website, on your website. If you're into social media, and believe it with, I think Gail Caseworm, she did a webinar with us, and she has information about how social media really is needed in this market as well, regardless of the age. And then also include financing options. Again, 48% said if they had known about CareCredit, they would have moved forward. Be proactive about managing your online reputation. And that's, you'll hear some of that in the symposium and how Bernie Stokes and others will help us to understand how we should, as practitioners, really proactively manage our online reputation. Second of all, you have optimize your website. Put the information on about products and in financing. And again, another shameless plug here from CareCredit. We have free tools and assets that you can use both on your website that gets that story across, as well as we encourage everyone, if you're doing your marketing, whether it be a print ad, whether it be a direct mail piece, or call it statement stuffers and so on and so forth, again, just mentioning that you accept CareCredit really attracts over 10 million. We have over 10 million cardholders who already understand the value of CareCredit, that may have opened it in the dental office or opened up in a vision office, that may have themselves or a loved one looking for other providers that would actually accept the CareCredit card. They already understand patient financing, and they use it many, many times over. But it also, by putting on financing on your external communications, indicates to those people that say, hey, look, you can finance your hearing health. And many people are looking to do that. Another thing is you want to make sure all your patients that are in your practice are aware of CareCredit in particular, but patient financing in general as a payment solution. Don't shy away from it. Again, people who walked in, right, actually, a lot of them didn't even ask, or 27% asked. Imagine now there's 76 others, or 74%, 73%, trying to do the math in my head here, that had you been proactive about it, may have moved forward even more, because 48% said they would have moved forward if they'd known about that. So we have all these assets that you can use within your practice. You want to set your pricing strategies, and initial financial conversations are very critical, as you know this already. You want to show your patients how monthly payments could be for the recommended device is an option for them. I know many of the practices that I deal with and work with, and with the CareCredit, sometimes in all verticals, not just in the hearing, but in, like I said, I'm over the vision, both in the ophthalmology side for LASIK, as well as in the optical side for glasses and all that. Some providers actually say, I only pull out CareCredit if there seems to be a need, or if the patient says there's a need. Well, again, 27% will ask about it. Well, there might be 73 others that would take advantage of it too, if you just bring it out. And so what we try to tell people is, and this is not anything new again, whatever your device is that you're trying to sell or to actually recommend for the patients to purchase to fit their hearing needs, you can certainly say, well, Mr. So-and-so or Mrs. So-and-so, your device today is going to, after everything's all said and done, if you have insurance and so on and so forth, discounts, it's going to be $4,500. I'll take cash and credit card. You can certainly do that. But it's as easy to also put, and then we have monthly payment plans. In fact, we have a 12-month no interest with paid in full promotion, and that comes out to $375 a month, right? So you can put a part down and you can finance the rest. And again, it's just open to everyone, offer it to everyone, let them make the decisions, because they will decide whether they want to do that or not. And then we also have some sample scripts and enhancements to teach your team how to present CareCredit. Many of our providers say, I just don't know how to introduce financing to individuals. I just don't know when to introduce financing to individuals. Forget CareCredit, but patient financing in general. Well, we made some audio scripts that it's very simple, how you can hear it, how you can teach your staff. Come by the booth and you can actually hear some of those. Those of you who are providers of CareCredit can download that, and you can teach it in your Monday mornings or Tuesday, whenever you have your staff meetings, how simple it is to just offer or mention patient financing in every situation that you may deal with the patient. And then one of the last things is you want to create advocates, right? Those patients that will help you to increase your referrals and help your practice thrive, right? You want to deliver exceptional patient experience so that they will talk to their friends and others about what it is that you are delivering to them. And that will include your post-care communications. And that really is going to be setting up for what the panel is going to talk about. There's 4 different pillars: how to attract those patients and communicate to them outside of your practice to get them to come to you, consumers to come to you to become your patients; how to really give the best practices and patient experience while they're in your practice; and then consequently, How do you use them to be referrals? And how do you recall them back in the 3 years when you're ready for the next technology? So on and so forth. So you'll find that out in the rest of the symposium this afternoon. And then for us, from a CareCredit, we have practice development managers, practice development specialists, all trained. They understand the hearing markets as well as the other verticals that they happen to manage and that you can get connected to. They'll be happy to come in and do a team training with you. They'll do it over the phone. They'll do it in person, give you the free resources and other best practices that you are maybe interested in and how to better perhaps talk to your patients, not just from a patient financing perspective, but best practices in the hearing market as well. And so the last decision that we all have to make here is, do we have any questions or do we have any comments to what I just talked about? So I'll open it up to you guys. Carl?
Randy, in previous conversation, you had talked about vision market and a lot of financing for glasses and optical are really low prices, right? What kind of prices are we talking about?
Yeah, so Carl asked, in the optical industry, where eyeglasses and contact lenses, there are lower ticket purchases. How low of a ticket, and is financing even germane for that market? And in reality, the vet market has some of the similar characteristics in that there are low tickets, buy glasses, contact lens, multiple pairs. Patients want to finance $200 or more. When it gets to be around, because we actually did a little bit of survey, it gets to be about $150. They're not necessarily interested in a 6-month preferred, deferred interest program. Around about $200 or more, they're interested. Because for 6 months, what is that? Can't do the math in my head, but it's very, very cheap, right? $200. Our average first ticket out of Optico is $530 on a CareCredit credit card. That is, and I can say this, I can't put it in writing, but I can say that that's almost twice what they would purchase, what they spend if they were using cash or a credit card. Even though CareCredit is a credit card, yes, we are a CareCredit, we're a CareCredit card, a credit card, our difference is deferred interest. That's what the patients like. So originally this panel, we were going to have an optometrist as well on here, because I know in the past couple years or so, my hearing contacts from the audiology world has said, Randy, I want to learn from the dental world. I want to learn from the optical world because there's some synergies there. And so unfortunately, there's a major optical show that's happening right now at the same time in New York, but maybe in the future. Yes?
I think I can talk pretty loudly. I'm curious about this. How much to ask? You said it goes down to about $200 or something like that the person would be interested possibly in taking something like this.
Yeah.
And taking the credit card. Using credit card. What is involved in getting a credit card by the public for CareCredit? How do they go about this? What's the requirement for it? How do they proceed?
Okay. Yeah, it's a very simple process. First of all, it is a credit card, so we would actually use their FICO scores, right, and other formulas to determine how much they would be approved, if they would be approved or not. What's interesting is a lot of people believe if you use CareCredit or present CareCredit at the end of a sale, when someone is hesitating, more than likely that patient probably would almost kind of thinks that they may not qualify. But reality, everyone, regardless of your FICO score. So it's a very simple process. You simply present to them, and we have tools that they can self-present. You go in, fill out the questionnaire, fill out the application with no more than a minute, 2 minutes to fill that out. Within seconds, they come back with approval. Or if they decline, they'll say decline or give them options on how they can get approved. But they're approved no more than 2 minutes. The 2-minute process is all. Now, providers can help in that assistance with that patient. But more and more, we're getting to the fact that patients can do it self-directed. They can either go to carecredit.com, or they can go through a mobile device, or within your practice, we have a new tool, if you come by the booth, it's called the Patient Direct tool that can work on a tablet or a patient-facing PC. And the patient just walks right through it, goes and applies. You as a provider, you don't have to worry about keeping any records because they get all the disclosures right then and there. They get their approval, they get their number, and immediately they can start transacting, regardless of the amount, if they did it directly themselves. So it's a very easy process. And if you have a time to come by the booth, we'll show you how easy that process is by making you apply. No, I'm only kidding. But you come by the booth, we certainly can walk that through you. Hope that answers your question somewhat. Yes?
Under what circumstances will the patient be denied?
You need to repeat the question.
Under what circumstances will the patients be denied? You want it denied?
Well, being a provider myself, the denial rate is very low. I mean, they basically approve fairly everyone. The only time I saw denials were during the 2008, that when all the banks were. But we have a joke in our practice: if you are breathing, they will approve you. I mean, they're very liberal about approving. So,
Yeah.
I mean, my practice have about 96% approval. Stephanie did a survey, and they're pretty good. I can vouch for them.
And let me just ask Matt Bowler, what is our approval rate here in the hearing market?
Well, it all depends on the demographics for who's applying. What I like to say, it's very overly simplistic, but we'll basically decline two types of patients. Either the patient that we're extremely confident that they will not be able to not be able to make payments on the loan, or we feel that we would be reckless by providing someone with such low income with a loan for a few $1,000s. We definitely approve into the subprime space, but not so deep subprime that, again, we're being reckless with giving someone a loan that shouldn't have one.
Yes.
I have a question about the online behavior that you're seeing with patients.
As this survey was online, how representative is that? So the people who respond to a survey online are likely to be online otherwise. How do you see this generalizing?
We actually, go ahead, Nancy.
It wasn't an online survey. They were contacted by phone first, and the people that could go online did. I'm loud.
Okay.
Did go online where it was a preference, and the people also answered the phone survey.
Oh, okay.
Yeah.
It says here online survey.
Yeah, so we try to be as comprehensive as, I think I had time for one more, and then we'll pass it on.
So you asked 209 people regarding to hearing healthcare, also about the importance of price. And I was just wondering, did you split between those who were already using hearing aids and those who were first-time users?
No, it was all over the board. Some of them were not even users at all. They were just they had recognized that they may have a hearing issue, so they were doing some research. Some had already gone to a hearing professional to get service, but it was, Nancy, fairly broad.
It's broad.
Yeah.
The determining factor in how they determined whether or not they were going to answer it was, have you already made a hearing healthcare purchase that required an out-of-pocket expense, or were you planning on making it in the very near future? And I think the time frame was 3 months, something like that. So the decision had been made that they were moving forward, and that's where we could capture why did you take so long and what were you thinking about.
Okay.
Make sense?
Yeah. I think that's all my time. But I would tell you, Matt Bowler will be up here, and I'll be here as well. Any other questions that you may have for CareCredit or this study, we can certainly answer it in the symposium time that we have allotted for that. So I don't want to cut anyone off, but we'll certainly answer any more questions about that.